Seema Verma came to HIMSS. She did My Healthy Data initiative. She did the Blue Button 2.0 initiative. Do you want to give us a little background on the two of those and where
Yeah.
you think they're going to go?
Well, let me begin by saying the announcement that she made couldn't have been more bipartisan, or maybe we would call it nonpartisan. If you removed the voice of Seema or the voice of Jared and simply read that presentation without knowledge or context as to who might have delivered it, you could have imagined anyone from the Obama administration carrying that message forward. So this is really building on progress and really pushing it further and faster in the direction that it desperately needs to go. So that's why you saw me applaud a great deal of the work that was done. The big message, I would say, is that the healthcare delivery interoperability strategy that I mentioned before, the B2B model, was built on the foundation of HIPAA authorizations, where you may share, you're allowed to share, but it doesn't compel you to share. So you could put a request in as a physician, hey, I've got this patient, could you send me the records? And if they chose not to respond, then you wouldn't get the data, but they were legally allowed to respond. And so we had this framework of you might be able to share, but you didn't have to. What Seema's saying is that the other half of HIPAA, the individual right of access, it doesn't mean you own your medical record, Bill. It means you're entitled to an electronic copy and in a readily producible format. These are words that are going to come into play in the API discussion. So Seema basically said, I'm going to pivot and embrace information exchange tied to that consumer's right. And that, I think, is the kind of sea change that naturally is a progression of where we learned as we went. And that's the model, I think, that's going to carry lowest cost, highest data liquidity, because it's a legal right to request a copy in a readily producible form, and she built on that.